Hello everyone, let us learn today bony features of the radius. Now this is radius, it is a lateral bone of the forearm and it is homologous with the tibia of the lower limb. As it is a typical long bone, it has got two ends, upper end, lower end and intervening shaft. The shaft has got three borders and three surfaces with a nutrient foramen. Now let us see first the upper end bony features. It bears a head which is dish-shaped and it is covered with hyaline cartilage. Okay, now it will take part in two joints, the superior surface which is concave, okay, that will articulate with the capitulum of the humerus and that will form part of the elbow joint. Let me show you. Now this is humerus and this is called as capitulum, right, and this is trochlea. So this capitulum will be in contact with the superior concave surface of the radius. Okay, so this will form the humeroradial part of the elbow joint, right. The circumference of the head is also articular and it fits into socket formed by radial notch of the ulna and the annular ligament, and together forms superior radioulnar joint, which is a pivot variety of synovial joint. Let me show you ulna. See this is right ulna and it has got a radial notch. Okay, so here this is how the radius fits into it. Okay, and remaining socket is formed by annular ligament like this, right, and it rotates within the socket, which is partly bony and partly ligamentous, right. So that circumference of the head forms the superior radioulnar joint, whereas the superior concave surface forms part of the elbow joint. Okay, now next is a constricted neck. You can see over here, and that is also partly enclosed by the lower margin of the annular ligament, right. Next to the neck is a tuberosity, that is called as radial tuberosity, which is rough posteriorly and smooth anteriorly, right. So this is about upper end of the radius. Now the shaft of the radius, as you know, it is a typical long bone, so it has got three borders and three surfaces, right. Let us see first the borders. First is the anterior border. Now we know the side of this bone. This is right radius, so this is anterior aspect and here lies the anterior border. Okay, the anterior border extends from anterior margin of radial tuberosity, okay, to the styloid process. Now here is a styloid process. So this is the extent of the anterior border. The upper half of the anterior border is oblique and it is called as anterior oblique line. The lower half of the anterior border is vertical and it is crest like. Okay, say this, it is sharp, it is crest like, but this one is called as anterior oblique line. Okay, now the posterior border, this is tubercle of Lister, so this is posterior aspect of the radius, and the posterior border is a mirror image of the anterior border, right, and it is clearly seen particularly in the middle third, right, but again it has got in upper half a posterior oblique line. Okay, so as it is a mirror image, again it is oblique in upper half and vertical in lower half. The upper oblique part of the posterior border is called as posterior oblique line, right. The third border is medial border, which is sharpest. It is also called as intraosseous border because part of it provides attachment to interosseous membrane, and it extends from the radial tuberosity above, you can see over here, right, to the posterior margin of ulnar notch below, up to this point. Now this is ulnar notch, and head of the ulna accommodates here. Let me show you like this. This is head of the ulna, and it articulates like this with the ulnar notch at the lower end, and together forms inferior radioulnar joint, which is again pivot radiosynovial joint. Okay, so that is about medial border or interosseous border. Now the surfaces, there are three surfaces. Anterior surface, it lies between the anterior border, okay, and the interosseous border or medial border, right. There lies a nutrient foramen along the course, okay, and the direction of nutrient foramen is upward, so the lower end is growing end for the radius, right. The branch of the anterior interosseous artery gives nutrient artery, right, to supply it. Now the posterior surface lies between the posterior border and the medial border, right, or interosseous border. Similarly, third surface is lateral surface, which is situated between anterior border and posterior border. Okay, specifically in the middle third it is rough, you can see over here, right. So that is about the shaft. Now the lower end is expanded, and it has got 5 surfaces: anterior surface, medial surface, lateral surface, posterior surface, and inferior surface, right. So the anterior surface, it is continuation of the anterior surface of the shaft, and it is crest like, and the radial artery is palpated against it, right. So that is anterior surface, but it is comparatively smoother as compared to the posterior surface. If you see, it bears 3 to 4 grooves, right, and a tubercle which is called as tubercle of Lister, right, which lies lateral to an oblique groove. Okay, so here is the oblique groove, and you can see laterally there lies tubercle of Lister. This oblique groove is lodging tendon of extensor pollicis longus, right. The medial surface is occupied by ulnar notch for the head of the ulna that we have discussed, right. The lateral surface is prolonged, and it forms the styloid process. Okay, the inferior surface, see this, it is articular, it is smooth, it is covered by hyaline cartilage, and laterally it has got a triangular articular surface, right, which accommodates with the scaphoid bone, and medially there is quadrangular articular surface for the lunate bone, right. Together these 3 bones and the articular disc will form wrist joint or radiocarpal joint. Okay, so this is about bony features of the radius. Hope you understood well. Thanks for watching.